Now let's talk about mental health and traumas. When according to the Centers for Disease Control and Prevention, mental health includes emotional, psychological, and social well-being. It affects how we think, feel, and act. It also helps determine how we handle stress, relate to others, and make healthy choices. The World Health Organization, or WHO, also believes that depression is one of the leading causes of disability. It also added that suicide is the second leading cause of death among from 15 to 29-year olds around the world. People with severe mental health conditions die prematurely as much as 2 decades early due to preventable physical conditions there. Now, despite progress in some countries, people with mental health conditions often experience severe human rights violation, discrimination, and stigma. Now, in March this year, iRadio collected suicide data in some states in the country, which showed that suicide cases were on the rise. iRadio also looked at the suicide rate in northern Bahr al Ghazal, Lakes, eastern Equatoria, and Jungle State. Now, the question remains, how does mental health affect the local population in this country? So, to shed more light on this story or this particular topic of discussions and trauma as well, I'm joined live in the studio by Nyamuj Lok. She's the master trainer and also trauma awareness specialist. With us in the studio also is Joanna Evelyn Mule, our friend, mental health advocate. It's good to have both of you in the studio this morning. Good morning.
Good morning. We're honored to be here.
Let me start with you. Yes, Locke, let me start with you and just give us basics when we talk about trauma in general. And this is something you've been involved in. Can you explain it to the listeners of iRadio?
Thank you, Akile. And it's a good morning to all of us. First of all, we'll like to define trauma itself. People are always saying, I'm traumatized, I'm traumatized. What is trauma itself? So we can define trauma as an emotional wound. When something shocking or something painful happened to you and leaves you overwhelmed, this is what we define as trauma. A lot of events, traumatic events might happen to different people, but our reaction is whatever. It's what shows that we are traumatized. So trauma, if we look at South Sudan today, there's a lot of conflict, violence, and a lot of things has happened. So with the ongoing fights in the country, trauma itself is the one maybe causing violence, or violence, it's the one causing trauma. So we first need to understand what is this trauma and what are the causes of this trauma. So that's what first thing I would like to say. Thank you.
Yes, and Joanne, you can also add something on this, and especially in a country like South Sudan, and you mentioned conflict and also violence, one of the factors contributing to the high rate of this trauma and mental problems in this country. But what do you make of this topic of discussion in general, Joanne Mule, as an advocate?
Thank you very much, Joseph Akile. First and foremost, I want to appreciate iRadio for the opportunity, and for looking at mental health and all that comes with it as something that the country has to look into. Yes, as she said, mental health, I would say mental health is the state of your mind, the well-being of the state of the mind. Now, if your mind is not sound, if your mind is affected by things that we'll be mentioning later on in the discussion, for example, depression, anxiety, trauma and all that, you are not going to be able to be productive in the society. You will not be able to impact the society positively. And I would say trauma and mental health are things that our societies, need to take serious, and it is a collective responsibility for everyone to make sure that we are okay, because if your mental health is at stake, it means mine is also going to be at stake. So yeah, mental health and trauma are things that move hand in hand, and we need to deal with.
Yeah, and Nyamoch, if you are to assess or evaluate the level of mental health and trauma in this country, how would you really break it down to the listeners of iRadio? How do you look at in general, your assessment on this trauma and mental health in the country?
Okay, thank you again, Akile. So if we look at the South Sudanese population today, we can say that we can see from the action of people that the level of trauma is high. This happened, we've seen a lot of people using alcohol, excessive alcohol use, drugs abuse, and even in terms of violence, let's talk of things like domestic violence, suicide, as you mentioned before. So we can say all these violences or conflict that is still going on, it's because of trauma. It's not happening only with individuals. We've seen it mostly around the country. We've seen even if we look at the communal fight, this is because of violences. There's revenge killing at the state level every day, every now and then. Cattle raiding. All these are because of trauma. Okay? So like what she mentioned, if we are not healed from these events that happened in the past, we'll not be able to reach our full potential just because our mind is not stable. We still have a long way to go for us to heal, to reach that full potential that we need to work for ourselves. So we'll still be in this cycle of violence every now and then just because we still have this unhealed trauma.
And talking about healing, and especially in the remote areas in this country, Joan Mule, how difficult or how easy is it really for these to be realized on the ground, for people to know that they can recover, they can overcome this trauma? Do you think it's possible?
Well, I think it is very possible for people to heal from these traumas and all that is related to mental health. But it takes a collective responsibility. It means we as people have to talk to these people on ground. We need, because it's like on the population of 12.5, over 12.5 million people in this country, we need to... I believe that everyone in this country is affected. You know, we are not mentally well. And that is why if you're to see the international media, it's always reporting South Sudanese as violent people, right? And we happen to be amongst the youngest countries in the whole world.
One of the unhappiest countries even in the world.
Imagine, you know, yes.
Although we're laughing now.
Honestly, yes. So it is very possible, but it takes, you know, it takes everybody's responsibility to get on ground. And first thing we need to do is to get to know what is mental health, because many of these people or many of us do not know what mental health is. We do not know that we are traumatized. We just think it's in our culture, it's in our DNA that South Sudanese are hardcores. That is what we think. And that's why we try so much to resist, you know, the acceptance that we are mentally ill. And yet we are. So we need to, you know, take it upon ourselves to understand what mental health is.
Right.
Yes.
And how can we really try to address this from the grassroots, Nyamoch, the issue of how people perceive South Sudanese out there, that they are violent people, they are always fighting. And by the way, let me just remind you, last week, this is what the Presidential Advisor on Security Affairs, Tut Galwag, even mentioned when he was addressing diplomats, that Nas Diamond Bishu Junubi Nas Bitamashakil, but this time is for peace. But why do people really perceive South Sudanese as violent people? Do you think it's also because of trauma? Can be one of the reasons?
Yeah, thank you, Akile, again. So there's one thing I always say, like, trauma causes violence and violence causes trauma. So when we are traumatized, this is how we are trying to act out this trauma energy that is in our body, that because we didn't release that trauma energy in our body, we need to fight. We need to release it. This is the one way that is making people violent in this country, because of trauma. Okay? If we look like it's like what you asked, like on the ground, people are not stable, okay? I can say Juba might be the only safe place. The states are not very safe at the moment. I don't know why. Is it Juba? We cannot have peace at Juba only, and there's no peace at the state level. It's just because people there are idle, and what they do is just think of fighting. And this is because of the unhealed trauma. Unhealed trauma. People hurt people, you're hurting people. You just want to violence act all the time. So this at the state level, people need to just focus there. We might not be like doing it at once, but we should just at least try. It should be a gradual process.
Right.
it will take time.
Right. And John Mulle, Luogo earlier mentioned something to do with domestic violence, and that brings me to the question of mental health. Do you think this is actually contributing to mental health problems in the society? In some traditions, or in Africa in general, people believe that you beat up your child, so that's how you can raise him or her to be a better person in the future. So, but in a way, some psychologists are also arguing that it's contributing negatively to the growth of the children. So, do you buy the idea of domestic violence is contributing to mental health problems in the country or in the society?
Well, I want to say domestic violence is one of the greatest causes of mental health issues or trauma in our societies. And I condemn it in the strongest way possible because, as you said, I want to correct something again. Beating a child for something he has done, but not excessively. I mean, telling this child this is not right is so much different from domestic violence. Now, if we get to domestic violence, of course, this comes with a lot. Physical abuse, psychological, emotional, and all that torture that comes with it. So domestic violence is a very, very, very big and one of the greatest factors that brings about, mental health crisis amongst us. So let's imagine a child, I mean, we all know how early marriages are really, really great. It's like almost most of our cultures practice this, early marriages. And it's,
even forced marriages happen also.
Yes. So a child, I would say a child who's below 18 is forced to marry an old baba, right? Yeah, an old man. And, there isn't any connection. So when this young child who's married off gets to the marriage, things don't work out, right? And then you find that this man is trying to traumatize this girl, and she runs home. He's beating her, and then she runs home. But the parents will be like, "Go back to your marriage, right? You have to go back," and that alone is trauma.
She has no say or no choice to actually decide for
Exactly
herself because of the traditions.
Exactly.
Now, you earlier condemned this domestic violence. Are you calling for an end to domestic violence in the country?
Definitely. I would say that nobody should ever even support domestic violence. Domestic violence is something that is criminal, I would say, and if our leaders could take it upon themselves to really, really make sure that domestic violence cases are reported and they are, these culprits are actually punished for it, and the communities and the society get to know that if they do this, these are things that are going to be done. I think we can, overcome this domestic violence.
And Yamol, that brings me to the issue of the statutory law and the issue of some of the traditions and beliefs in our culture, and it contradicts what the Constitution stipulates. So how can this really be addressed? Because they are always having this loggerhead, the Constitution and also some of our traditions as well, which is encouraging, some of them are encouraging domestic violence.
Yes. So I'll also mention something on the domestic violence.
Go ahead.
There's some post that I saw on Facebook the other day. It was talking like South Sudanese women, if you don't beat them, they feel like you're not a real man. So a woman will...
So they say, when is my husband going to beat me?
Yeah,
I can't wait, But it doesn't happen with the boyfriend and girlfriend. It's a kind of different thing. The beating apart, especially.
Yes. So what I wanted to say is that women also need to know that you don't need to be beaten for a man to prove himself to you.
Yes.
It's not always the men that are beating women. Even some women are beating their husband. Okay. So domestic violence is happening both ways. It's either the man beating the husband or the husband beating the wife. So there's some our traditional cultures or some harmful cultural practices that are happening in our communities. I can talk in terms of trauma. They are really causing trauma. Yes. We talked of the forced marriages, of the child marriages. These are things that are really making life hard. Like now in this situation we are in, things are very hard. So a man will prefer a daughter to get married just because he will gain something from it. So this is a real false thing, because girls are seen as source of income.
For bride price.
For bride price, okay? So these things, we need to give awareness to our communities. Like these things are causing a lot of traumas. You will go and stay in that man's house with the all trauma. You will not be happy for the rest of your life. And when you're not happy, sometimes it's affected when your children. You will be beating them. You're transferring that trauma to the children. Children will grow violently. This is how the all trauma grows. Okay, so we need to give this awareness to our communities, like child marriages, all this domestic violence. This will not be able to grow as South Sudanese if we're still doing these harmful cultural practices. Okay, so it's all about giving awareness to our community.
Right, and just a follow-up question, Nyamoch, you earlier talked about alcohol regarding this trauma. When people are traumatized, sometimes people resort to taking alcohol, and there are different
Drugs,
testimonies,
yes.
and drugs even. There are different testimonies. Others are arguing that it helps, and others are against this. So how do you look at it? Do you think alcohol can help when someone is traumatized?
No, it cannot help. Okay. And it's another thing in our culture. When something, let's say, traumatic event happened to you, they'll tell you, take this small alcohol. Today you take small. Another one tomorrow. The other day, what happened to you? You'll be addicted to alcohol, and you'll need it every day. So when you're taking that alcohol, you're abusing it, excess of alcohol.
And what about those who take it responsibly?
So, okay, what I understand, alcohol, you should take it for enjoyment,
Right.
not excess, and not abusing it. So when you are in this traumatic situation, you'll take it like you're dying, you're killing yourself, okay?
Right.
So when you're doing that, you'll not be able to produce, you'll not be productive like Joanne mentioned before. This is what we need, is us to be productive. You need to wake up in the morning, go and work, go and do something for your children. But when you're taking the alcohol every now and then, you'll not be productive. You'll not reach your full potential. We need to be stable for us to be able to work for ourselves and our communities.
Right, John would like to add something on this part of alcohol, especially looking at the rate of young people in this country.
Yeah, sure.
70%.
Exactly. So yesterday I saw a post where somebody said, I mean, I think that's Bida, one of the journalists. He posted on his wall saying, South Sudan is where some people, where the unemployed go out looking for jobs, and then they return home drunk. Right? And then on the comment section, I saw a number of people saying we are traumatized because we do not have jobs, right? And then somebody else said, oh, they've worked hard. You know, the person went and worked and is trying to reward himself for the hard work, right? So basically, I mean,
interesting,
that was funny, but the truth is we are abusing alcohol. You know, why? How? You know, when we start to use alcohol as medicine to stress management, then that becomes a problem. You know, it becomes a problem. So many of our youth, I want to talk about the niggers in town. I want to talk about the Torontos. You know, all these kids, they get these drugs. I'm shocked to learn that these kids actually know a lot of these drugs. Where I stay, there's a small clinic. So these kids come to buy certain kind of drugs, right? And these are meant to be prescribed for certain diseases. Right. Because they have the knowledge. I don't know where they get it from. They know that these drugs contain certain drugs that make them...
Sometimes you mix one and two and then it becomes something
Definitely.
different.
So they add to alcohol and then drink so that they can, you know, get high, which is very, very bad.
And that also goes to the authorities. What do you think authorities can do on this, especially the abuse of drugs, especially the Bureau of Standards and local authorities as well?
First, I think our people, the authorities need to really, really put strong regulations, especially to where these people get these drugs. These doctors, these nurses who sell these very drugs, you know, because if they already know their customers. If they know that this person is buying this drug, they need to know why are they buying the drugs, right? You cannot just...
It has to be prescribed by a doctor, for instance.
Exactly. They have to go and get prescribed, diagnosed, and then also, prescribed, and then they get this from the pharmacies. Right. So I think the authorities should take it upon themselves to ensure that these people who sell the drugs are certified, they're not scammers, they're not people who are trying to make a living out of it. And also they need to put strict laws, in the health sector as far as, the abuse of drugs is concerned.
Now, let's take a look at some of our comments on our Facebook page. Someone here is saying mental health issues is very widely very wide in the country, and trauma is very high as well, has resulted into many problems, and many individuals are using their thinking or their brain so much because of this. Another one is saying, kindly pass my sincere regards to the two guests in the studio. All right, thanks for that. Another one is saying trauma occurs when the person experiences abuse and it develops actually unhealthy attachment to their abuser. Very interesting point from Lara Magdi. Well, let me come to you, Locke, with the comment from Lara Magdi. Are there any, let's say, when someone is traumatized or mentally ill, does it result into other illnesses, for instance, or does it like escalate in when you talk about the health condition of the person?
Yes, thank you, Akile. So what happened is when you are in this traumatic situation, or when you're traumatized, yes, there's possibility of you having
developing other complications, for instance.
Yes, because even your thinking is not the way it's used to be. There's a lot of things. You'll be getting sick anyhow, you're having a headache, your body's paining, you have a back pain, you what. So sometimes it's you can have a lack of appetite, you're not eating well, so it will end up, your body will reduce, or you even eat too much, you become too huge. So these are some of the things that also lead to some of the, yeah.
Joan, you earlier talked about depression and anxiety. What is that? Can you break it down to our listener?
Okay. Thank you very much, Akile. Depression and anxiety, I would say, in the way that anybody else understands is, when we normally have shortcomings in our lives, right? We do have issues, we have stress, we have things that keep us not settled mentally. So the more we get to think about the problem, instead of thinking of the solution to the problem, we eventually get into depression, because this is how you look at it. When there is a challenge that you're facing, and then you're really focused on the challenge itself and not thinking of a way forward, you will eventually get to live with the sense that that problem can never be solved. And so, or maybe your thinking capacity of seeing the possibility of that thing being solved becomes low, and that leads to depression. You get to get so much into that problem, and that will affect your mental health. And when it comes to anxiety, for example, that means you're overwhelmed about a situation in a negative way. Okay? You just don't hope for a positive thing to come out of something that you are about to do, or something that happened. So that is it.
Now, Nyamoch, let me ask you about the role of parents. And when we talk about mental health, because sometimes people are traumatized, people grow up when they are already traumatized. So how can parents contribute positively to ensure that their children are really not traumatized when they are growing up?
Thank you, Akile, for that question. Okay. Trauma, even children traumatize. Though for children, it might not be a long term like the one for a grown-up person. Right. So every time you beat a child, they also grow up knowing that I was beaten. There's some of the things even you, when you were a child, you still remember. So this is the trauma. So the thing is, a parent needs to also have time with their children. One thing I will also want to say, it's about South Sudanese not having their families around them. So you need to see your child growing up. You need to know what do this child do during this time and this time and this time. Okay, we need to take care of our children. We correct them, not beating. Violence, sometimes even the child will grow violently. Correction. You sit down. People fear talking. So the moment you initiate that conversation, people fear. They'll say, tomorrow I'll be asked, why did I do this today and tomorrow and the other day? So when you just come, you beat your child, it's because you're also traumatized. So you also need to heal as a parent for your child not to grow up with the same trauma you have.
Right.
Yes.
Joanne, let me ask you a little bit kind of personal question. I understand you were our colleague here. You were once a journalist here at iRadio, and now you are an advocate, mental health advocate. What actually motivated you to do this? And this is something unique. In what outcome or input are you trying to put out there to ensure that at least you contribute in the community and society? And do you have any support or any group that is pushing you to help you to do this?
Well, thank you very much. First and foremost, I want to appreciate you for the opportunity once again. Well, about mental health, I have been depressed before. I have undergone a number of situations, where I thought there was no solution, and yet I needed somebody to talk to. But I did not trust those around me to air out what I was feeling, right? And it was really a hard time for me. Yeah. So recently, just this year, I was shocked. I was surprised when my nephew committed suicide. So this is a very lively person, a person whom I was so close with him, and I could not believe that he could commit suicide,
In Juba,
right?
yeah?
Yes, in Juba. So it really became, I kept thinking, why did he? Till now, as a family, we are not aware of why he took his life. Yet, because he was a very nice guy, he was always happy, and that kept me thinking, probably we are all mentally ill, because while I was also depressed, I did not share my issues with other people. I was this happy person that everyone thought all was well. So I saw, and just a week after that, another also, someone from my community committed suicide, and 3 of them committed suicide in a period of 2 weeks, and that was shocking. That was shocking. And that made me feel like we need to normalize talking about our issues. We need to start to talk about our issues. And that is why we need to create awareness on mental health. And about the question of if there is support or what, no, there isn't any support that is materially, but I am very humbled, because I keep posting this on my social media, and my friends and all those that have seen the messages have reacted positively.
Yeah, share with us your social media platforms for people who are watching you live on Facebook and also on
My personal social media account is Joan Mule, and we've created also a mental health page, that is Mental Health South Sudan, where we'll be sharing all these updates. So I call upon all people out there who'd love to support mental health. You can, if you're psychiatrist, psychologist, and all mental health experts, and all those are willing to volunteer, those who are willing to volunteer to make sure that we can talk to these people. And the goal here is to see that South Sudan is well aware of mental health.
Right, and wish you all the best in that. If we're running out of time, I give you each less than 1 minute for your last remarks. Let me come to you, Nyamoch.
Okay, thank you, Amule. So what I would like to say here is at the moment, like, everybody's going through a lot, and we can say the population, everybody is traumatized. We're seeing some violence contact on Facebook. These are things that traumatize us. There's a war in Russia and where. So what I would like to say is people should take care of themselves. Make sure your mind is stable most of the time. Eat well, shower at the right time, go around what things that will give you peace of mind. What we all need is peace of mind. If individuals have peace, that means all of us will have peace at a country or a South Sudanese. So we all need to take care of ourselves. Thank you.
Right. Joanne, briefly?
Yeah, I want to say mental health is a human right, and for us to make sure that mental health is put out there, that people get to know mental health, it should be a collective responsibility. So everyone should take it upon themselves to ensure that in the society everyone is mentally ill. I mean, mentally healthy. Thank you.
Right. Thank you for that. That's Joanna Evelyn Mule, mental health advocate in Nyamocha Lok, master trainer, and she's also a trauma awareness specialist. Thank you both for joining us on The Dawn today.